Social Determinants of Health Screening for School-Aged Children and Adolescents webinar. My name is Shamika Davis, and I'm a program manager at the School-Based Health Alliance, and we are glad to have you with us for today's webinar. The School-Based Health Alliance is a DC-based nonprofit founded in 1995 and serves as the national voice for school-based healthcare. Our focus includes policy, standards, data, and training to support and grow school-based healthcare, particularly school-based health centers. We believe that all children and adolescents deserve to thrive, but too many struggle because they lack equitable access to healthcare services. School-based healthcare is one solution, bringing healthcare to where students typically spend the majority of their time in school. When schools, families, students, and the community work together, students win. I would like to share a few reminders for today's webinar. All attendees are in listen-only mode. To ask a question during the webinar, please use the chat function. Closed captioning is enabled for this webinar. To turn it on, please click the CC button on your Zoom control panel. At the end of today's webinar, we invite you to complete an evaluation. Your responses are important for helping us understand how to improve our work. Also, a copy of today's PowerPoint slides and recording will be available soon. I am happy to introduce our presenter for today, Dr. Maureen Murphy. Dr. Murphy is an accomplished and dynamic family nurse practitioner with over 20 years of nursing experience. She fervently believes in holistic care and is dedicated to addressing social determinants of health. Dr. Murphy is deeply passionate about community care and has successfully coordinated and facilitated the opening of 7 school-based health clinics. While working as an advanced practice registered nurse, she took the initiative to create and lead an in-home high-intensity care management services with interprofessional healthcare services. As an assistant professor teaching community health nursing, she is resolute about making the course and clinical experience truly impactful for both the students and the community members, emphasizing the crucial nature of social determinants of health screening and its influence on health disparities. Dr. Murphy has been the pioneer of the concept of curbside immunization event with social determinants of health screening and assistance. Her findings were recently published in Nursing Administration Quarterly. Currently, she is driving change at Corewell Health school-based clinics in the Detroit area and continues to bring her assertive leadership as an assistant professor at the University of Michigan Flint School of Nursing. I now welcome Dr. Maureen Murphy.
Well, good morning, everyone, or good afternoon, everybody. Thank you so much for that warm welcome, and I appreciate having the opportunity to speak with you all today. They're asking me to start the video, so.
Yes, Maureen, I'm sorry. If you can turn on your camera for us, please.
Okay. There we go. Hello, everyone. We'll get all this technology all straightened around. And again, I really appreciate the very warm welcome today and have a great message. And so I believe in having this conversation and am open to further conversations down the road if you ever want to chat with me. So today we're going to talk about why do we do social determinants of health screenings and why do we need to collect that data? So let's begin. Next slide. There we go. You've done a great job talking about me. Thank you so much for that. The objectives today are simply that we hope to increase the audience knowledge of and capacity to determine what kind of screening tool you may choose and how that could affect perhaps a community needs assessment and how to really adapt that to make a workable workflow for you, as SDOH screening is so very, very important. So again, thank you for joining. Next slide. So we do need to start with the background and the significance and what are social determinants of health. And I really kind of keep it on a very basic level so that everyone can come to the same page. And that is where we live, work, and play are very powerful predictors of health outcomes. Social determinants of health are estimated to be responsible for up to 40% of preventable deaths in the United States. And that is a very powerful statistic. 40% of preventable deaths are related to social determinants of health. So why would we say it's important to complete the social determinants of health assessment? Well, certainly, first off, it's best practice, right? We know that best practice recommends that we should be doing a social needs assessment about the patient's social situations and their lived experiences within a medical visit. This is currently supported as best practice by the American Academy of Pediatrics, by the American Academy of Family Physicians, by the American Medical Association, IHI, and the National Academies of Science, Engineering, and Medicine. And quite frankly, probably many, many other organizations as well. So it is best practice. Next slide. And so as we look at the significance of this, we understand that having a standard system to collect this aggregate data is very beneficial in both a downstream and an upstream approach. And to really understand what I'm talking about when I say downstream and upstream, let's watch this quick little video. It does not have any sound, and everything is, you can see it. You'll understand. Thank you so much for showing that video. And let us go back to the slide that we were at, if we can. Excellent, excellent. So you could really truly gather from that upstream, downstream, especially as we talk about how burdensome our clinic flows are, that we are often in a very downstream approach and just trying to survive and keeping our patients as healthy as we can. But when we use a social determinants of health screening tool, and then we collect that data, we can start looking at the bigger picture. We can aggregate that data and maybe use it towards our needs assessments, policy, grants, and really overall support to a community, because now you're looking at the bigger picture. Now you're understanding what is in my community that's affecting it the most. So aggregating the data is very, very important, and some EHRs can do that automatically. So next slide. So when we do not follow best practice, as we said, using a screener tool is, or using these Z codes for that matter, a practice gap exists. And we understand that in an attempt to fix this, a change occurred back in 2018 with the official guidelines for coding and reporting. And it was at that time that they said, hey, we got to start using these Z codes. So what we're going to do is allow anyone in a medical visit, not just a physician, but a medical assistant or anyone for that matter involved in that care of that visit that day can use the Z codes Z55 through Z66. These are specific social determinants of health codes, and they want all of us to start utilizing them so that we can collect this data a little bit better. So they do all this in 2018, and yet the workflow still flounders today. It's still very much underutilized. Next slide. So we really need to start asking ourselves why, right? And I thought it was interesting in 2022, there was a survey of American physicians, and they revealed that almost all physicians felt that their patients had a health outcome that was affected by at least one social determinant of health. And that's huge when you start thinking about our 40% of preventable deaths in the US, right? And that 61% feel little to no time and lack the ability to effectively address their patients' social determinants of health. So here this is telling me, I don't have time in my regular workflow to address these issues. And I don't have an effective work system that can take care of it once I have found out if there was an issue. And 83% believe that addressing patients' social determinants of health contributes to physician burnout. Now let's pause for that for a minute and let's think about, if I'm getting burned out, it's probably because my workflow is not in place. And I already know that they all have one affecting their social determinants of health, and I'm getting burned out. And burnout is a real issue in the United States in our clinics. And I say this because I've worked right alongside you all. I get it. It's a very, very common problem, no time and a burnout perspective. Next slide. And that leads us to a further discussion. So I don't know if you guys recall, but a few years back, the IHI came out with what they called the triple aim. And that was in regards to quality and safe care. And they said, if we can make sure that we have quality with better outcomes and reduce our costs, and we certainly have better patient experiences, then we are on target for quality care. Well, they figured out down the road that they needed to improve this concept. And so they came up with the quadruple aim at that point. And that realized, and this is why this is so poignant to our previous slide, is that healthcare workers need to experience joy in what they do. That truly, if a provider is burned out, that will impact all the other factors. And so let's take a case scenario, for example, about this. If Karen comes into your teen clinic and she is in need of an asthma rescue inhaler, for instance, maybe she's having an actual asthma exacerbation. It is perhaps her 4th visit to your clinic with the same complaint in the last 3 weeks. You realize you can give her the emergency medicine she needs right now and get her back to class, but you cannot help her with her housing insecurities that are causing her to sleep right next to a very moldy wall all night. And you can't even ensure that she might have the medicine for controller medications that are typically prescribed. But imagine how frustrating that must be and how burnt out that feeling must be. You can't really help this child. It's a continual downstream approach. Yet on the flip side, I propose to you, what if you had a way to help? Imagine resources that were there, that were in place, that didn't burn you out with your timetable. And then you could put your medical opinion on it. So for instance, sometimes I will say you can't turn somebody's electricity off if they have to use a nebulizer. And I will write notes for patients in that regard. So imagine if we had a way to help. And then I ask you, would you really be burned out then? Or would you feel empowered like that is why you went to school, right? I also, before we move on to this slide, want you to realize, and I thank goodness, they've even updated the aims even further to the quintuple, because we realize that everyone is entitled to equitable, accessible care. So, next slide. And so as we dive in further, I really want to ask you, how many of you screen for social determinants of health in your clinics? And if yes, how many use a screening tool? This is just a kind of a way to get a barometer of what's out there. And thank you so much for doing that. And Shamika, when you think we should move on, I will let you move the slide and we'll go from there.
Would you like for me to share the results?
Yeah, that would be great if you don't mind.
Yes, right now, for how many of you screen for social determinants of health, we have 65% have stated yes and 35% no. And then for question 2, if yes, how many use a screening tool? 69% yes and 31% no.
Okay, excellent, excellent.
Yes.
Good, very good. Thank you so much for doing that, you guys. So it kind of is in alignment with the fact that oftentimes school-based health centers or school-based lookalike centers often do psychosocial assessments. Many times this is a grant requirement done yearly, but it is a great way to get that full holistic picture of your patients. So usually what you might find is that some of those social determinant questions can be pulled right from those already psychosocial assessments you're doing, and you can crosswalk them over to an ICD-10 Z code. Next slide. So as I say this, for instance, HEADS is a psychosocial interview tool for adolescents. It was developed years ago, and then they updated it in 2004. It includes questions such as about school activities, employment, drugs, suicidality, sexual orientations, and even recently about eating and safety. So let's take a look at it. Next slide. So we just did, today's webinar is going to also give you, I call it a job aid. I like to work smarter and certainly not harder. And so we took our job aid and we looked at the questions that were in the HEADS examination, and we were able to crosswalk right off the bat some of the Z codes that could be pulled right from your psychosocial assessments. So that's another way to view on how you could screen. Next slide. This is the prepare, and oftentimes we see FQHCs use this, and it is completed by the parent or guardian. I certainly think you could send home a paper version of this and have it come back with your sports physicals, for instance. So there are multiple screening tools, and I just want to give you a little bit of a dip into what's available out there. So this is the prepare. Next slide. And a lot of people use the hunger vital sign. And what's nice about this is that anyone can use these questions as long as you cite your source. And even if you just do these two, and the reason why I say that is that sometimes to do a big screening, you got to be able to still allocate resources and know what to do with your results, right? And if you're just starting out small, maybe doing 1 or 2 questions that you think might be most poignant to your population and having everything lined up gives you a good pilot project, if you will. But so this is the hunger vital sign, and it's used quite frequently. It can be done by parents, guardians, and adolescents. Next slide. In Michigan, we often use what we call RAPS, Rapid Adolescent Prevention Screening. We do this with our psychosocial assessments, as well as they have a public health one that would be more apropos for screening social determinants of health. So just wanted to let you know, and that is done adolescents 9 through 21 can fill that one out. And next slide. I want you to pause here for a second because look at how many more screening tools are out there. And there's probably even more as we go along. So I wanted you to know, again, these slides will come to you. You can shop around. These are some nice basic slides that will give you names of screening tools that you may choose to use depending upon your population, whether you want the parent to fill it out or an adolescent to fill it out. So, and again, I say to you, before we move on, with one of my coworkers, she said to me, you know, I do junior high, and I'm not really comfortable doing an SDOH assessment with someone of that age. So this is why I say shop around. There's nothing that says that these social determinants of health screening tools can't be sent home with those sports physicals, right? And I think we need to get into the process of actually doing like universal screening. It's just something that we do with all of our patients so that the parents and the adolescents and everyone are just used to these kind of questions. Next slide. And this leads me to a very interesting study that was done nationwide with teenagers. And typically asking about should we do social determinants of health, and the teens prefer to have universal screenings, and that is that they are often a little afraid or embarrassed to bring up their issues. There may be a lack of access to the resources, and they don't know how to obtain that or where to seek help for it. You don't know what you don't know, right? And so that is why they feel overall that universal screenings would be of great benefit. Also, it's important that the way we approach these questions are very genuine, right? We've got to make them feel comfortable because sometimes they're disclosing very sensitive topics. We also know that teenagers often prefer to use electronics, and they'll be typically more upfront about real issues if it's on an electronic. Now, you can do paper, but you certainly got to make sure that you can provide them with the proper privacy, right? But teens definitely in this study understood the correlation between social determinants of health and what kind of medical care they receive. So they're very much aware of how this can impact health outcomes. Next slide. So really, let's keep this real, short and simple. We want the questions to be written appropriate and appropriate for your population. So if it feels like they cannot relate to the questions, they're not going to take the survey seriously. They might not even answer it, or you might just get all yeses or all nos, right? We've all had those. Or they may not understand truly what you're assessing for. So, and this is where I also say, you know, if you're just starting out, maybe perhaps doing that pilot before scaling it to all determinants, and realize that there really is no current standardized screening tool that's out there. So everybody is just trying to find what works for them, and evaluate the one you have. So that's why I say pilot it, check it out, and evaluate it. Is it really what you need? Is it getting proper information? And we'll talk a little bit more in that as far as how we're integrating it into your clinic workflow to see if it's appropriate or not, right? And then you also should also ask, do you want help? You know, people sometimes, it is what it is and they don't want the help, but it's still good to ask if it is a problem, because it could be other problems that manifest from that. Okay. Next slide. So I truly had some problems with some of the questions. I didn't feel it was, teenage friendly. So I created my own questions that were in alignment with overall questions. Dr. Luger and I developed these, and then I made my life easy. I put my Z codes next to where I thought might be an appropriate positive, like, does your family have difficulty getting to a big grocery store? Is that transportation insecurity, or is it a lack of adequate food? And if it became often, that would be a red flag, and I would dive deeper. These are screening tools only. No matter what screening tool you choose, we cannot use an ICD diagnosis without validating in deeper conversation and then putting that in your note, right? You need to be able to do that too. So, and I've also put it, there's a couple of slides here so I could just show you my workflow here. I've also, if it's in red, and I do that for my MA, that if we see a positive here, I need to really check into that before they leave, before they leave my clinic, right? Okay, next slide. So these are just one more of my questions that I would typically ask them. And you can see what's so cool about these Z codes is that if you look deeper, they really are appropriate for teenagers and for younger children, especially the school parts, right? Next slide. And one more time, there's only 16 questions here. So it's a good little screening tool that we developed for our workflow. Now this, you guys, this is something I think you'll really tune into once you get these slides. This is what I call the job aid of Z codes. I last reviewed it back in May of 23, so it's pretty inclusive of all the most current SDOH codes. And so you take an issue and then you go to your job aid, because here's the thing, ICD-10 codes, there's so many, such a plethora. How do you know which one? And then you got to try to look it up, and all that takes time. So I've got this laminated, and I flip it over and I say, okay, where am I going with this? And then I'm like, boom, that's my Z code. So my job workflow is a little bit easier. And let's show them that C55, and it goes all the way to Z65. We'll show you that on the next slide. And you can even see that I highlighted the newer codes because I always want to, make sure that we stay abreast with that. So I really believe these job aids help your workflow process. Next slide. And we'll play with the job aid a little bit in some case scenarios. So using Z codes. So this is from CMS, and they really, like I say, this is best practice. They want us to do it all. How do we collect that data? And again, just like I said, anyone who is a member of the team can collect the SDOH data, right? At any intake. And so now you've collected it. Now you've got to document. So in your EMR, you should be making, yes, I validated that this is truly an issue. And I'm making a quick little note about that. And now I'm mapping it to the Z codes that are appropriate. I'm now moving along to step 3. And I'm probably using that job aid that I'm talking about to make my life easier. And I'm coding particular SDOH codes. Now I've done this. Now I can look at and analyze this data and do care coordination. Now I say some EMRs can take your coding and coordinate right to care coordination. I mean, it's pretty cool what some of these EMRs are doing. But even not, I mean, if you have your resources available, and quite frankly, let's say I've got a food insecurity. And so I list all of my pantries and where I can get my patients, maybe even a box of regular fresh fruit and vegetables weekly, right? All of that is listed. But I say to my patients or the parents, hey, take a picture of this in your phone as well, because if I just give you this piece of paper, you're going to probably lose it, right? So how do we get them going to the referrals that they need, and how do we track that? It would be really great if your EMR did that, but so start thinking about how you can create your EMR to do it, or another system to be able to track those referrals. And then the last part is reporting the Z code findings. So this is where the cool thing is you can aggregate these data, EMRs, or possibly you can do problem lists, however you do it. Most of us are in electronic charting, where you can do it by diagnoses, and you can see, oh my gosh, I've had so many Z55s, or I've had so many of these, or so many Z65s. That tells you I got a problem here, and that'll help you with your grant money. That will help maybe get you a care manager. That will help funding in your own particular clinic. So I always say data is power. Don't be afraid of it, right? Next slide. And now let's just talk reality, right? Like, how does this really look in a small clinic that doesn't have a lot of probably staff? Like my clinics have a MA, does front and back and ordering. I have a social worker there, and sometimes some of these clinics are part-time social workers, and myself. So how do we make this clinical flow work? First off, we're going to assess, and we try to assess before they come into our clinic visit. We try to do it in the waiting room with an iPad. So we're assessing in that way, and then we're flagging those SDOH concerns. Either the MA is looking at that, or I'm looking at it. I'm doing it before I walk into that patient's room so that I can address those, right? And then I'm going to dive deeper. I always say, let's pull the onion back. Let's find out in a very genuine way, is it really a true positive? I say that because some of these questions might be related to abuse, for instance, right? And then when you dive deeper, you realize it's just the brothers on the front lawn, horsing around, really not abuse as far as what you would categorize it. So you do have to dig deeper, and then you have to make that note, like I say, in the EMR, quick little note, and then map using the job aid to the Z codes. Super important. Have those resource and referrals ahead of time. And if you're doing a pilot one, maybe you only start with a couple, so you know you've already alignment with your resources and referrals, so that workflow is smoother. And then you report those findings out. Next slide. So if we can all just take a breath for a minute and really feel like, how could we do this, and look at some case scenarios. And I know you don't have the job aid in front of you, but it will become apparent as we walk through these. So together we'll create a mock process for screening. We'll think about how a clinic would logistically screen for social determinants of health. So we'll read these case scenarios together, and then we'll think about a possible way that we would have for resources, and look at how we would map to the Z codes, okay? And so let's have some fun, right? Let's look at our next slide, our first case. And so Aaron is a 16-year-old boy visiting your school-based clinic today for ear pain. He's been having this ear pain for 1 week. He lives at home in Staten Island, New York, with his mom and his 3 sisters. His father is incarcerated, and he hasn't seen him in 3 years. Through the use of an in-office social determinants of health self-assessment tool, he reports that he started working at a concrete company last summer to help his mom with the bills. They provide him with earplugs, but he admits that he doesn't always wear them. He reported that his mom doesn't always have enough money to pay the electric bill each month. And I don't know about you guys, but I often have many multifactorial concerns with my patients. So let's take a look at what we came up with. Next slide. Okay, you can see how it's bolded. His father's incarcerated, hasn't seen him in 3 years, working at a concrete company, doesn't have earplugs, admits doesn't always wear them. There might be some concerns with finances. So we came up with 4 of these Z codes by using our job aid, occupational exposure to noise, absence of a family member, other problems related to education and literacy, and possibly some financial insecurity. And you as providers may not pull them all out, but certainly this just kind of gives you kind of a way to map, a way to migrate what might be appropriate. And Shamika, if there's any comments or questions that you feel like that are coming through, feel free to interrupt me at any time because we're a team here. And we can go on to the next slide. So Carlos is a 15-year-old adolescent male who is visiting your school-based clinic for the first time today. He lives with his father and mother in migrant housing on an area farm where his parents and other family members are currently working, harvesting the late summer vegetables. He has complaints of persistent abdominal pain starting about 3 weeks ago. He notes that he just started 9th grade and is 1 year behind in school because his family moves around a few times a year and he failed a few final exams at the end of last school year. He is having a hard time adapting to the new school and making friends. When asked about the abdominal pain, he states that he lives with 4 other families besides his parents in a 4-bedroom home. The house has electricity and running water, but no heat or AC. He also notes that he does not have internet access because it is not available on the farm due to how rural it is. He also discloses that while he is a U.S. citizen, both of his parents are not, and he does not have health insurance. So you can start seeing in your mind, even before the Z codes come up, what might be pulled out of this. So next slide. And again, areas that are bolded show you some of the concerns. Migrant housing, 1 year behind in school, moving around a lot, adapting to new school and friends. So we have Z55.2, failed school examinations, underachievement in school. If you look over to all these Z codes that are potential, insufficient health insurance coverage, housing instability, social exclusion and rejection potential. So many Z codes here for poor for Carlos here. Yeah. And next case scenario. We have Sarah. Sarah is 16-year-old adolescent female visiting your clinic because of persistent headache times 1 month. While talking with the MA, she states that she has been living with her grandparents for the past 3 years after her mother has died. Now her grandmother has advanced dementia, and she has been spending most of her free time outside of school caring for her. She notes that she wears glasses, but the ones she has are broken, and she has not been back to the eye doctor for a checkup in about 4 years. Next slide. So thinking about Sarah, we can look at these Z codes, and she's definitely being brought up away from her parents, absence of family members, disappearance and death of a family member, dependent relative needing care at home, and maybe some other insufficient social insurance and welfare support, right? And I think that that's also something to consider, is that she's spending all this time with her mother. We might need to dive in deeper and see if we have, issues like under the Z55 as far as problems related to education and literacy, especially if she has no current glasses, right? Okay, next slide. Eric is 14 years old. He is visiting the school-based health clinic for his yearly sports physical. He notes that he is planning to play on the 9th grade football team. However, he has previously gotten into some trouble at school and is not even sure that he'll be allowed to play. He is living with his 3rd set of foster parents since being removed from his parents 1 year ago. He has 2 other siblings living with another foster family, and they get to see each other for an afternoon every 2 weeks. He remarks that he has had some low grades, which might also be a barrier to participating in sports. Last year, he got into a fight at school, resulting in a suspension and the end of the relationship with his former foster family. Next slide. Oh, yep, there you go. So we have quite a few Z codes that we could use with this if we had our job aid out in front of us, and Eric described all of this information to us: failed school environments, underachievement in school, educational maladjustment, and discord with teachers and classmates. And I would just say to you guys, I get a lot of that, right? Those often my patients are the ones that are struggling in school and are having difficulties with teachers. And so important for them to be able to come to our clinics, right? Upbringing away from parents is probably difficult for them. Problems related to primary support groups, absence of other family members. And I would say one thing that I think is very, very important, that we have learned through studies, that education is one of the biggest leverages to somebody in a low socioeconomic concerning situation. So what we want to do is we want to capture these kind of situations when they're adolescents and help them with their school. So when we say to ourselves, yeah, but they can't really handle all of the other social determinants of health, there are many that we can help with. And so I encourage and empower all of you to keep going. Okay, next slide. Denise is a 17-year-old visiting your clinic for STI testing. She is 5 months pregnant. While being groomed by the MA, Denise tearfully states that it is her second pregnancy and she doesn't know how it happened, as she was using protection. Her mother is raising her first child. She said that she is no longer with her baby's father, that the relationship was chaotic, and I'm glad to be away from him because he used to hurt me. States she has low family support and is currently living with a friend. She says, I'm just couch surfing. I hope to get my own place soon. And there are many teenagers that do couch surfing, and they understand the term, or they go from auntie to auntie, So having that genuine conversation, you will really capture quite a bit of information. So looking at that, think to yourself, what kind of social determinants exactly might I have? And we have problems related to unwanted pregnancy, problems in relationship with spouse or partner. All of these relates to, housing instability, as she is couch surfing, personal history of intimate partner abuse, problems relating to the health literacy, as she didn't understand what kind of protection she used, what kind of situation involved still getting, the pregnancy. So that is Denise, and let's move on to the next one. Tarek is a 16-year-old male who recently moved with his family from Ukraine. He visits your clinic today seeking information about how to get his asthma medications refilled. He speaks English, but has been identified as able to read only at the 5th grade level. And for the past year, he has not been able to attend school in Ukraine, in the previous country. He's living in ministry-supported housing with his family as they become established in this community. At this time, they do not have a personal vehicle and rely on public transportation. He states that his parents are in the process of getting work visas, so money is very tight. He feels like he is adjusting to school okay, but does not have any friends yet. Despite having been in school for 3 weeks, he feels a little isolated, but is hopeful about the future. Next slide. So you can see, again, job aid would bring over illiteracy and low literacy levels, schooling unavailable or unattainable for all of that whole year while he was in Ukraine, definitely housing instability, transportation insecurity, financial insecurity, other problems related to social environment, and definitely probably is having overall material hardship. So this is Tarek, okay? So hopefully those case scenarios kind of wrap up how you can kind of pull out some of those Z codes that you might need. And I say one more thing to you. How do you use this data as far as how it relate to a needs assessment? And, I know that we're all over the country as far as different guidelines for these school-based centers. But I know in Michigan, we have to do a needs assessment periodically. And then we have to focus our programming elements based on these needs assessments. So, you know, we could do a focus needs assessment, which is often what we do in our clinics because we're looking at just the population of our community, of our clinic. But then there is more a comprehensive needs assessments, and those typically are those multidiscipline, looking at the entire community, all ages, all health concerns, all demographics, right? But either way, your focus needs assessment or your comprehensive, the Z codes can help. And again, I probably pretty poignantly pointed out that these Z codes can help as you push for, more staffing, different grants, how you make a difference with your policy, with trying to push different policies, with your health education. So you could take, let's say you have one particular Z code that's really giving you maybe food insecurity, for instance. And you could even do a workshop on how to eat healthy on a very low budget. So you could create different kind of programming elements, different health educations based on where your Z codes push towards you. I definitely believe that having care coordination would be a big help. I know that sometimes our FQHCs have those already, and I think that's so wonderful. But these Z codes would help potential that push for more staffing in that regard. I want to show you the next slide, the comprehensive needs assessment. On the next two slides, and we're not going to leave this slide yet, but this is pretty much like what you would see on these big scale community-based comprehensive needs assessments. I draw your attention to the health status of the population. Look at how it goes right after those social determinants of health. I don't know if you're familiar with the social vulnerability index, but this is something that correlates with social determinants of health. It is looking at characteristics, and you get a score. The higher the score of a community shows the more disparity financially and physiologically somebody or a community would be if hit with a disaster such as a tsunami or like the pandemic, for instance. So, I'm from the Detroit area, and we had very high social vulnerability index numbers. And then COVID really hit Detroit much harder than our surrounding communities. So the social vulnerability is important as far as social determinants of health, understanding your county ranking. For instance, Wayne County in the Detroit area is 83 out of 83. So understanding where your county on a broader pace is very important, in looking at those social determinants, even on those comprehensive needs assessments. So I wanted to really kind of hone in on that and show you both perspectives. Go ahead and show them the last slide if you don't mind. And again, those are just, I share you that because if you're going to do a real comprehensive needs assessment, all of these particular factors or bullet points should be covered. Next slide. And so life isn't about waiting for the storm to pass. It's about learning how to dance in the rain. And so I challenge all of you to be the change agents, to push this forward, to do SDOH assessments with Z codes, because quite frankly, it's the right thing to do. And so I'm here to answer any questions if you may. And Shamika, I'll turn it over to you.
Thank you, Maureen, for a wonderful presentation. And thank you all. And thank you for your questions. We do have some questions that have been submitted for you.
Okay.
One question is, and this was in regards to the slide where you showed on steps using Z codes. So how would this be able to be used in a health department setting?
Oh, that's a great question. So I would think that you could still be able to do your screening questions, right? And then I would, I don't know the parameters of who's in the health department, but if there was someone who could review that, maybe a counselor, because I tell you what, social workers are actually, they've been doing this for a while as far as the Z codes. And so, but if you had a counselor who could review that data and then link to resources, right? Um, and then somehow does the health, my question back to you, does the health department have any way to create a problem list? You wouldn't be doing necessarily the Z codes, or perhaps you could, if there was some kind of electronic record keeping. In fact, my son works for the health department here in Macomb, and he does have electronic records. So I'm sure they do have a way that you could still use the Z code and collect that aggregate data. But I think screening, making sure it's true, creating resource, and then collecting that data on the surveillance system could still work in a health department. Absolutely. Great question. Great question.
Thank you. And our next question is, do you think we can use Z codes based on just the screening tool if it's done by an adult, or should codes only be used upon further conversation?
I truly believe these are screening tools. You need to screen. You need to take it a step further, in my opinion.
Thank you. And the next question is, all the screening tools you mentioned, are they for adults as well?
There are multiple. So some are adults only, some are that adolescents can fill out on their own, and some the adults have to fill out for children. So there are a plethora out there. And that's why I just decided to list them all, let them kind of shop around and find what's good for you. I like you can see, wasn't happy with really, I picked and chose, right? And then I kind of said, I need to make this more appropriate for my teenagers, right? So I even put on one of my questions, do you couch surf? Do you move about? Right? I need to know if you have a housing insecurity, but I can't really ask a teen, do you have a housing insecurity? Because they're going to be like, what? So you have to create it in a way that will give you a proper result.
Thank you. Yes. And the next question is, are there paper copies and electronic all available in multiple languages such as Spanish and French in regards to the screening tools?
I would imagine that they're getting better and better at that.
Thank you. And the next question is, would you recommend using the CMS tool, Accountable Health Communities for Screening? They could mandate it in the future to standardize screening.
I really hope that we do get standardized screenings down the road, but I hope that the only concern I have for that is our adolescent population. So our adolescent population, if it is too adult-like, they're not going to answer it. So I'm not opposed to standardized screenings. I think they're a great idea. But we need to still figure out maybe, how do we get a standardized screening tool just for adolescents? And so maybe I push mine through even further, but I do think it's a great idea to have standardized screening tools. But doggone it, we got to make sure that they're appropriate for our teenagers.
Thank you. And the next question, this was in regards to one of the screening tools. Does the screen also include mental health screening for depression or only basic social determinants of health?
Well, every screening tool is a little bit different. Like the hunger sign, for instance, it's only going after, food insecurity. But a good screening tool, a very comprehensive screening tool, will go after that and will also go after, are you in a safe place? Has there been abuse? And so that's why you even saw me, even on mine that I developed. Hey, if it's red, it was my way of telling my MA, if it's red, we need to immediately pay attention to that and not let somebody slip through the clinic without validating what's going on.
Thank you.
Yeah.
And the next question is, Who is usually the best person of contact to have for communications between the school and school-based health center?
In regards, could you repeat that? Because I'm not sure where
Yes.
they're going with it.
I'm gonna just say, who is usually the best person of contact to have for communication between the schools and school-based health center?
I'm assuming in regards to social determinants of health. You know, every school is a little bit different as far as their resource systems in place. Um, First off, you certainly have to be careful of HIPAA, right? You have to be very careful of that. But connecting to different liaisons within each school system, I can think of one in particular in one of our clinics. They have a whole network, a parent network, a resource network that can immediately connect them to different services. I also see another clinic, they don't have that. So, you know, they only have homeless liaisons. So it depends upon each little school district on who would be the best. But I would definitely make sure and empower you guys to think beyond even just your school systems because they're overburdened as well, right? Um, think about other resources that are out in your community. What kind of pantries do you have out there? Who can you get um, if they're having problems paying their bills? What can you do to assist them? Who's some liaisons out in the community? And have that stuff. But here's the thing, you guys, you can't do it on the fly because that's how you get that burned out cycle. You've got to have kind of that set up in place. And then boom, it's an easier transition. So it took me a while to create my resources. And then, you know, they fade out, right? Every church leaves its site sometimes, or there's funding issues, or so you have to keep updating on those resources as well. I hope that helped. I mean, every school district's a little different. Yeah.
And thank you, Maureen, and thank you all again for your questions. I apologize. We did not have the opportunity to answer all the questions, but we do have your questions logged and we'll be sure to follow up with you, as well as if you have any questions following today's presentation, we'll share our contact information with you. And just a few announcements before we conclude today's webinar. The registration is now open for the 2024 National School-Based Healthcare Conference that is taking place June 30th through July 2nd in Washington, D.C. To register and to learn more information, please visit the School-Based Health Alliance website, as well as you are welcome to scan the QR code. Also, we invite you to stay connected with the School-Based Health Alliance. We have our School-Based Health Alliance Digest, as well as we ask you to stay connected with us on our social media platforms. At this time, I thank you, Maureen Murphy, Dr. Maureen Murphy, for a wonderful presentation on social determinants of health screening for school-aged children and adolescents. It is greatly appreciated, and thank you for all the information you shared. Thank you all for attending today's webinar. At this time, we are going to launch the evaluation, and we ask that you please complete an evaluation of today's webinar. In the upcoming days, you will receive an email with a copy of the presentation slides as well as the webinar recording. Additionally, the webinar will be available on the School-Based Health Alliance website, as well as the presentation slides and the Health Center Resource Clearinghouse website also in the upcoming days. If you have any questions following today's webinar, please feel free to contact the School-Based Health Alliance at info@sbhforall.org. Again, thank you, Dr. Maureen Murphy. Thank you all for attending today's webinar, and I hope you have a good rest of your day. Thank you.